my name is Marianne Lombardi, and I am the Associate Director for the Creative Affairs Office here in Washington, D.C. Welcome to the Care for Creatives Community Conversation series on mental health. Care for Creatives is a partnership between the D.C. Creative Affairs Office and the George Washington University, which provides pay-what-you-can mental health support to any creative and entrepreneur in the D.C. area who needs it. You can find out more information about Care for Creatives and how to receive care on our website at creativeaffairsdc.com. I am so excited to welcome our guest, psychologist and mental health counselor, Dr. Barbara Musgrove. Thank you so much for being with us, Dr. Musgrove.
Thank you for having me. Greetings to all your listeners.
Thank you so much. Well, I'm thrilled for you to join us in this conversation about substance abuse. And as we get started, I would love for you to tell us a little bit more about your practice.
Thank you, Marianne. I've been in virtual psychotherapy for more than 3 years. I started in November 2017. I provide mental health services over the various platforms that are safe and secure for those who want to work on their mental health issues along with substance abuse issues.
Thank you. Speaking of substance abuse, for the purpose of our conversation, can you help us define what it is and what it means?
Substance abuse involves a pattern of harmful use of any substance for mood-altering purposes. And these substances can be alcohol, marijuana, cocaine, nicotine, or any other drugs prescribed that we may use incorrectly or outside of the rate that the doctor has prescribed. And again, it's a pattern of harmful use, and that harmful use can lead to some kind of impairment. The impairment can be in terms of your job, daily responsibilities, taking risks, health issues, and things of that sort.
So it sounds like, I think it's interesting that you're talking about it, is that harmful pattern of use. So can that abuse be deployed to substances that we may not think are traditionally harmful?
Of course, yes, nicotine and caffeine. Nicotine is widely abused, and it's very difficult to get off of nicotine. And caffeine is legal and widely used and difficult for people to stop using. It interferes with your health, mental and physical.
So it sounds like there's also a lot of language that is used around substance abuse, like recovery, addict, clean, sober, those kind of terms. And how does that language contribute to a person's identity and how they see themselves and other people see them?
That's a very good question. And it's important to eliminate stigma as much as possible. Some programs still use terms like addict, in recovery, and others just take that person as he or she presents himself or herself. And that can be as someone who's having trouble with drugs. I'm using too many. I want to get off. I want to reduce my use. So whatever term works for that person is the one we want to go with.
Yeah, so you mentioned stigma. I can imagine that there is, a lot of stigma around substance abuse. How does that contribute to whether people get help and the kind of help they get?
It definitely contributes. I have many people who, by report, will tell me they drink a 6-pack every night. They have some shots over the weekend, and I'll say, well, it sounds like you're developing a pattern of dependency. Could you go without it for a week? How would you feel? Oh, no, I'm not an addict. I'm not an addict. Immediately they say, okay, no, I'm not saying you're an addict. I am asking you to consider reducing your use to see if you'll feel better, if you'll sleep better, if you'll be able to think more clearly. So I try to find those things that will motivate the person with whom I'm speaking to reduce and eventually have their use at a place that will not be harmful to them. I almost never call anybody an addict. Programs frequently do, and certainly in 12-step recovery programs will ask people to acknowledge that they're addicts. But I almost never do. I look at that pattern of use. I ask them how it's affecting them. I challenge them to see if they can reduce the use and see what kind of effects they receive as a result of changing their use.
Over your time of working in this space, have you seen the attitudes shift around at all, either from the clients that you work with or say their family or peers?
Yes, there's been a great deal of shift in the way we treat people who have problems with drugs and alcohol. First of all, we usually don't say drugs and alcohol, we say drugs. So that's all of them. And we've shifted from considering long-term inpatient care to be the most effective treatment, going back to the days of the 50s, 1950s, when people went to programs and you stayed for a year or more, to 9 months, to now 28 days. And that 28 days is the beginning of what we now call a continuum of care, in which you go from 28 to 30 days of essentially detox, inpatient, intensive kind of grouping, almost round the clock, but emphasis on exercise, diet, all kinds of self-care, well-being things happen in a 28 to 30-day program. Then you go into intensive outpatient care, which may be 3 to 4 days a week where you come in for 2 or 3 hours a day. That drops down to outpatient care. And then ultimately, you're only coming in once a month. But this continuum of care lasts 12 months or 12 to 15 months. During that time, you are going from total dependency, physical dependency, or psychological dependency on the substance to the detox, and gradually learning new skills and ways to manage the stress that we all encounter in life. So the time is one place where we've changed our views on treatment. We used to think you had to go away for a year. You had to, whereas we now recognize that you can get the same results if a person is committed to a year to 15 months of care. The other thing that's changed is our idea about harm reduction. Many of us who started in the field years ago never thought we would advocate anything like reduced use. Even methadone, people didn't necessarily like to use. But now we recognize that methadone is medication. And for some people, methadone or the other agonist or antagonist drugs used can be very helpful in the treatment of substance abuse. And so it's reducing the harm caused by the impairments, the harm caused by health issues, the harm caused by crime that is committed sometimes to secure money to buy drugs. So those are the shifts that I'm very much aware of and excited to be a part of, to still be able. I can look back and I know the year-long programs, and I love the year-long programs. But I also know that there's great, great benefit in that 28-day program on that continuum of care. I also know that some people never do a 28-day program. They may use medication on the and just do everything on an outpatient basis, where they are still maintaining their work schedules, but they're using medication to gradually reduce their need for opioids or other substances they may be using.
Well, it'd be interesting to know what some of the signs of substance abuse are, and what the mental and physical impacts of that abuse might be.
Yes, again, very, very important to be aware of yourself, first of all. If you know that you're someone who's pretty much always on time, you don't miss work except for serious illnesses. Of course, we should all be missing work when we're sneezing and coughing, but being aware of that, knowing that you always meet deadlines, so you start missing deadlines, you find yourself being more irritated than usual. You are not sleeping as well. These are some signs that perhaps you're using too many substances. And I encourage people to journal, to sort of write down. You don't have to do major literary things, but write down, Monday, I was really moody this morning. And then you think back, well, Saturday and Sunday, I was toe up the whole weekend. So by Monday, it's having its effects on me, and it comes out in my irritable mood. I'm not completing deadlines. hey, I have a pattern here. I'm missing every other Monday. I'm off from work. So those are things that the individual would look at for himself. It's always better if I can do a little bit of self-diagnosis. It's very, very important that I accept that there's something going on. Then people outside of me, my family, my boss, even people in the neighborhood might see me doing things that are a little bit out of character and seem strange, are also some signs that, hey, something's going on there.
Yeah, you bring up family and peers. It makes me think about what the impact of this abuse might be on the family, whether it's your biological family, your chosen family, your community, what some of those impacts might be.
Well, again, people who love you care about you and they're scared for you. They don't want to see you fall apart and have a hard time and lose your job and go all the way down to the gutter. They don't want that. So first of all, they're frightened for you. Then secondly, if you begin to show major personality changes that you can lead to violent behavior, then they're scared for themselves. So I know it's difficult to hear, but when a family is asking you questions, is sort of bugging you about how much you're drinking, how much you're smoking, take it as a sign of their love as opposed to them just nagging you. It's because they love you. They are frightened. They want you to be okay.
Yeah, it sounds like that. Getting back to your point about the mental health, there's like anxiety can come up, that fear that on a lot of sides from the person who may be struggling, as well as the family member. Are there mental health sort of impacts that develop based on this?
Yes, depression is something that we don't like to talk about. We feel that, oh, we can shake it off, it's not a big deal, but depression is a very, very serious illness. And I don't know that we want to say it, but I need to say it. Depression untreated often leads to suicide. And the coming down from most drugs is a very low kind of thing. So if you already have a sad kind of personality this time of year around operating, then when you come off the drug, it can very easily lead to a lower feeling or depression, and can lead to feelings like, okay, the world would be better off without me. Let me jump off. And that's very, very traumatizing for you as well as for your family. And anyone who loves you is traumatized by a suicidal attempt, and certainly traumatized by a successful suicide.
Yeah. Well, it sounds like the need for those family members and those people who love you to have support and maybe even treatment is important as well.
Definitely. Yes. And in the 12-step movement, which again is not treatment, the 12-step groups are recovery, but they're an important part of recovery. They do help people maintain their positive steps, their new attitude, their new renewed strength and motivation. So there are family groups that are there to assist the family members in understanding what's going on. And what I tell people all the time, when you first go into these groups, you don't have to talk, just go in and listen, because you will hear someone say something that's similar to what you have experienced. And you'll also hear someone else say, and this is what I did. So that's very helpful. I also say during this time of pandemic, when we are still having a lot of virtual meetings, very few face-to-face meetings, you can go in and you can keep your face covered. You can change your name. It's a time when you can hear without totally exposing yourself. And that's why it's called 12-step programs, and why they are Alcoholics Anonymous, Narcotics Anonymous. It's not about knowing who you are, but it's about providing you support, encouragement, hope, and motivation as you hear others tell their stories.
Yeah. And are there other ways to seek treatment that aren't within the 12-step environment? Are there new either community opportunities, or what are some of the other avenues that people can seek help through?
Well, you certainly can go to your private physician And there are some physicians in the DC area, in the DMV, who are authorized to use the agonist drugs that will assist you in the detox process. So it can be done on an outpatient basis. There are also clinics where you can, if you want to use methadone, is generally given out in a clinic. So you can get involved with a clinic for that purpose. DC has a hotline number, the Department of Behavioral Health has a hotline number where you can call and access services. And then SAMHSA has a hotline number that can be used to access services. So you have to see what's available in your community, but certainly there are more options than going inpatient. I mean, inpatient is certainly one way, but there are many outpatient options that you can take. The first thing you have to do is, as I said earlier, self-diagnose. Be willing to acknowledge that my use of substances is not healthy. It's impairing my professional growth. It's impairing my family life. It's just not making me feel good anymore. So I need to reach out for help.
Well, I think this has been such a great conversation, Dr. Musgrove. Is there anything else you think we haven't covered that or something we could leave our community with as we exit this conversation?
I would want to leave the community with the observation that recovery is real, treatment works. There's help out there for anyone who believes and is willing to embrace the idea that, hey, my use of substances has gotten out of hand. And so I would leave you with those hotline numbers. The DC Department of Behavioral Health hotline number is 888-793-4357. That number is answered 24 hours a day. That person who answers can direct you to the right place to get treatment. Let me also say to you that if you're in the District of Columbia or Prince George's County, and I think even Montgomery County, and you are having an emergency with alcohol or any other substance, you can go to any emergency room of any hospital in DC, Maryland, and Virginia and get immediate assistance. SAMHSA, the Substance Abuse Mental Health National Hotline, its number is 800-662-4357. If you do not live in the DC area and you're hearing this or seeing this broadcast and you want some help, call the SAMHSA helpline, which is 800-662-4357.
Thank you so much, Dr. Musgrove. This is really wonderful information. I really appreciate your time spending it with us today.
You are welcome. Thank you for inviting me.
Absolutely.